live at 10.
We are seeing improvements, so we're cautiously optimistic that we're heading in the right direction.
Staying on that road to slowing the spread and reopening schools and businesses in Arizona is up to you. That's the advice from the state's top health official.
KOLD News 13's Melissa Egan went one-on-one with the director of the Arizona Department of Health Services this afternoon. And Melissa, where do we go from here?
Well, Dr. Christ says Arizonans have been doing a great job on those simple health practices, wearing a mask, washing your hands, and staying home if you are sick. But she says it's going to take more of that to get us back to wherever our new normal is.
Really, we need people to go get tested, even if they're asymptomatic, so that we just know what the community spread is.
As cases top 185,000 in Arizona, it's the steps you take that can make a difference. The director of the Arizona Department of Health Services says, for a start, the slowdown of a community spread will lead to students safely returning to schools. Benchmarks released as recommendations.
We've heard a lot of positives. They were really pleased that we did set thresholds with actual numbers and the metrics.
Local leaders and health departments will ultimately make their own decisions on opening their doors. Right now, an executive order still requires districts to offer a place for students to go if they need one on August 17th, ready or not.
When you bring groups back together, we will see increased infections just because that's how the virus is transmitted, is person to person.
Is that risk at some point worth the reward? Dr. Chris says it's important to get kids back in the classroom because of all the services schools provide. But going for a beer at your neighborhood bar may still be far off. At least with data, she says they are reviewing every 2 weeks.
Right now, I think even like as you look at the schools data, we're not at a place where we can return to in-person activities like that. But as we get more into, where the schools are in a moderate phase and they're hybrids, we certainly can look at potentially reopening some of those types of businesses.
Do you want to touch a little bit on where we are on that process, Doctor?
Sitting next to a business-minded boss, the doctor has been caught in the crossfire of this coronavirus pandemic, stressing she's in charge of data, not decision-making.
How are you doing?
Doing pretty good.
With a smile, she touts support around her, despite nearly 200 healthcare professionals requesting her resignation, saying she failed to follow science to push for steps to slow the spread, and they've lost confidence in her leadership. She says she serves at the pleasure of the governor.
I don't have a lot of time for stuff that's not related to the pandemic. I've got a great team here. They're very supportive. The governor is very supportive. If he ever asked me to step down, of course I would do so.
And we did receive a statement from Governor Ducey's office on that resignation request. It said, in part, we are lucky to have her as part of our team and have 100% confidence in her. Dr. Christ also said she's seeing a quicker turnaround with testing and results and not hearing of those same delays that we were reporting on in the last few weeks. I have more of our conversation on KOLD.com.